Okay, we don't like that. Hold. Let's see if it affects this arm too. Is this shoulder okay?
Yeah.
Hold. Yeah, we don't like that. So when you bite down on that side, you're creating a focus of stress. We don't like that. What's causing it? I have no vague idea. It could be SI joint. It could be foot on either side. It could be temporal bone. It could be mandible. It could even be upper cervical. So let's do some tests. Put it behind your back teeth again and relax the arm. Put all your weight on this foot. Now put that foot back down again. Hold. Okay. Breathe in. Hold. Breathe out. Hold. Good. Tuck your chin in like that. No, like this. Hold. Well, that's Atlas. Okay? So we went to the TMJ too soon. We forgot to check the spine. Lie face up on the table. This is yours. Bring it back next year, next week, next month. Face up on the table. So when anybody tests you today, use that stick again. Okay? Everybody gets one stick. Keep your head on the table and tuck the chin. Relax. Okay? So the original test I showed you at the beginning of the quarter, tuck the chin, legs balanced, Atlas. I don't know the listing. May I adjust your Atlas? Okay. So let me get some input regarding the misalignment. Your head weighs like 12,000 pounds. I've never felt that like this before. Could be lead poisoning. Relax your neck.
Got real dark.
Well, it feels like a left Atlas. Do a gentle adjustment, is that all right? Okay. Let's mobilize a little bit at stair step 4. Let's go back down. Keep your head on the table and tuck the chin. Relax, good. Go ahead and sit up and stand up. And put the tongue depressor on your right side. Bite down gently and hold. You get it? That's your tongue depressor. Left side, back teeth, arm out. Is the shoulder usable? This is better. Hold. Good, that'll be strong. Other side, this will be weak. Hold. Good. Let's see what it's caused by. Is it Atlas? Tuck the chin. No, like this. Hold. No, not Atlas. Put all your weight on this side. Back down, hold. No, not SI joint. Breathe in. Hold. Not sacrum. Exhale. Hold. Not occiput. Turn your head. Hold. Turn your head to the other side. Hold. No, it's none of those things. It's got to be TMJ. And it's not temporal bone. How do I know? Breathing didn't have any effect. It's actually jaw. Now, take that out, hold it in that hand, put 2 fingers from that hand right into the TMJ. Put this arm out and hold. Now, let's see if it's an opening defect or a closing defect. Put the fingers there, open wide, hold. Close halfway, hold. Close all the way, hold. It's a closing defect. When he closes, it gets irritated. He's bringing his body's attention to that. Keep your hand where it is and clench your teeth. Hold. No effect. Not enough. In other words, he doesn't have enough attention. being given to the TMJ just when he clenches his teeth, he's got to also touch. So you don't know what's going to irritate it. Jut your jaw out like this. That's good. Retract your jaw backwards. Hold. Move your jaw to that side. Hold. Move your jaw to this side. Hold. All of those things are great. I don't know what it is. It's something. You follow my rationale. I want to make sure that the TMJ you find today is really TMJ. Don't forget about the spine. That's yours. Bring it back next week. Okay. It can be done unilaterally or bilaterally. For emergency pain relief, we do it bilaterally. Lift your legs. Okay. So, stand on either side of the table. Get your thumbs behind the back lower teeth for as many teeth as are left, okay? And I'm gonna push posterior. So I'm gonna push his jaw towards the floor. Then I'm gonna pull his jaw towards his feet. Then I'm gonna pull his jaw up towards the ceiling in that order. So it's gonna be like this. I'm going to do it on both sides so everybody can see. Open and relax. My fingers are underneath the jawline, so I'm pushing posterior and I'm holding the push because I have to be able to feel when his jaw starts going posterior. Then I am pulling towards the feet, S to I. And I have to hold it long enough for me to feel the S to I movement. Then I am going to pull anteriorly. And he will tell you when I pull anteriorly, I sort of went like this. Okay? Now I'm going to do the same thing on this side so you folks can see. Open. Relax. I'm going to push posterior towards the floor and then inferior towards his feet and then anterior towards the ceiling. Very simple procedure. There's no thrusting, there's no audibles except accidentally, okay? And the thumbs do the pulling, and I'm sort of grabbing underneath the jawline. Got it? Okay, thank you. Visualize the same side, and the patient's head is going to be turned towards you. So turn your head towards me. Okay, so I'm going to stabilize this side, and I'm going to do what I just did bilaterally, but only on this side. Open and relax. And this is actually much easier. Now I'm going S to I. Before I went just A to A. And now I'm going P to A. And I'm stabilizing this side. You understand? And I'm stabilizing with my fingers underneath the jaw with this hand. And just stabilizing the temporal bone on this side, the whole side of the head. So when you're stabilizing the whole side of the head, it's much easier to feel the motion. Okay? We're going to do it on the other side. Turn your head to this side.
So this is the gross TMJ adjustment?
It's called a gross TMJ adjustment. It's non-specific. It is done for pain. It is done for a jaw that will not open as much on one side than the other. It's also very good for a jaw that opens. So if your jaw's opening, okay, so it's going this way, but it's not going this way, I would do it on this side. Okay. Open.
So the immediate pain relief is the same thing but bilateral?
Yeah.
Okay.
So I'm stabilizing with my right hand. I'm pushing the jaw posterior with my left hand. I'm pulling the jaw inferior with my left hand. And he will tell you there is some force involved. And then I am pulling the jaw anteriorly with my left hand, all the while stabilizing. Personally, I don't really like the emergency pain relief move. I would rather do this bilaterally because it's the same motion, you're just doing one side at a time. Okay? Thank you.
Thank you.
All right, try this on each other. And I'll do the setup on both sides. Lift your hands, scoot way up to the top of the table. Okay. Can you remove that area?
Mm-hmm.
So, I want to distract this mandible in that direction. Well, which hand do I use? I can actually use either hand. I can take this hand and grab the mastoid and stabilize across the squamosal suture. And this hand can go right there. And I can open up that joint and then thrust. And I almost thrust in opposite directions. Or I can reverse my hand and stabilize and contact like this. I don't care how you do it, but you're gonna stabilize here and you're gonna thrust in this direction. I tend to do it like this. I feel I have better leverage this way. The patient's head is on the table. Do not use a drop table for this, okay? If you use a drop table, you're gonna move every circle. Turn the head to the other side. My preferred way to do this is just like this. Okay? You can do this, it will work. It'll depend on the size of the patient's head. She doesn't have a very big head. Okay? But I want to get that force on the mastoid going opposite from my thrusting hand. Okay? So you're just using two hands on the same side. That's the big difference. The table is stabilizing the opposite side. So that's sort of the advantage to doing it supine. Try this on each other.